Some heroes save lives one patient at a time. Others transform entire systems of care. But on a humid Manila morning in 1957, a 46-year-old pediatrician stood before a converted two-story house on Quezon Boulevard and prepared to do both. Fe del Mundo had mortgaged everything she owned, pawned her jewelry, and invested her life savings into transforming this modest structure into the Philippines' first hospital dedicated entirely to children. Her colleagues called it impossible. Banks refused to lend her money. Fellow physicians questioned whether a specialized pediatric hospital could survive in a developing nation. But Fe del Mundo had watched too many Filipino children die from preventable causes, had seen too many families turned away from hospitals because they couldn't pay, had spent too many nights treating sick children in inadequate facilities. She knew what was needed, and if no one else would build it, she would build it herself. The house before her was small, the resources limited, the challenges overwhelming. But inside those walls she would create something that would change the trajectory of child health care in the Philippines forever. Fe del Mundo was born on the 27th of November 1911 in Intramuros, the historic walled district of Manila. Her full name, Fe Villanueva del Mundo, translated poetically as Faith of the World. A name that would prove prophetic. She entered a family where medicine was not merely a profession, but a calling passed through generations. Her father, Bernardo del Mundo, was a respected physician whose practice brought him into daily contact with Manila's sick and suffering. The Del Mundo household was privileged by Philippine standards, but oriented toward service rather than indulgence. Fe grew up watching her father treat patients, learning early that medicine was about alleviating suffering and that doctors bore responsibility for their communities. Several of her siblings pursued medical careers, creating a household where dinner conversations revolved around anatomy, disease, and the challenges of providing health care in a tropical nation with limited resources. Fef's childhood provided advantages unavailable to most Filipino girls of her era. She attended good schools, had access to books and education, and grew up in an environment that valued intellectual achievement. But privilege did not shield her from tragedy. When Effie was young, her sister died from appendicitis. The death was preventable, the kind of tragedy that occurred all too frequently in an era when child mortality remained devastatingly high even in relatively wealthy families. The loss planted a seed that would define Fee's future. She watched her parents grieve, understood that medical knowledge existed that could have saved her sister, and recognized that countless other families lost children to diseases and conditions that proper medical care could address. The tragedy personalized what might otherwise have remained abstract statistics about childhood mortality. Fe decided early that she would become a doctor, specifically a doctor who treated children. In 1920 Philippines, this ambition was extraordinary. Medicine was male-dominated everywhere, but particularly in traditional Filipino society, where women's roles were narrowly defined. Few Filipino women attended university at all, and those who did rarely pursued medicine. The cultural barriers were compounded by practical obstacles. Medical education was expensive, training was rigorous, and society offered little support for women who challenged conventional expectations. But Fe possessed advantages beyond her family's support. She was intellectually brilliant, demonstrating exceptional aptitude for science and mathematics. She was also stubborn, refusing to accept that her gender should limit her aspirations. Her father, himself a physician, encouraged rather than discouraged her ambitions. The Del Mundo family believed in education and service, values that transcended conventional gender restrictions. Fef pursued her medical education with single-minded determination. She excelled in her studies, proving to skeptical professors and fellow students that women could master the complex material required for medical practice. She graduated from the University of the Philippines College of Medicine in 1933, one of very few women in her class. The achievement was significant, but for Fe, it was merely the beginning. Medical degree in hand, Fe del Mundo aimed higher. She wanted specialized training in pediatrics, the field she had committed to after her sister's death. The best pediatric training in the world was available at Harvard Medical School and its affiliated hospitals in Boston. In 1936, Fe applied for admission to Harvard's graduate medical program. Harvard rejected her application. The reason was simple and explicit: she was a woman. Harvard Medical School had a long-standing policy prohibiting women from enrolling in its programs. The institution that prided itself on medical excellence and academic rigor maintained barriers based solely on gender. For many applicants, rejection from Harvard would have ended the dream. Fe del Mundo was not most applicants. She challenged the policy directly through persistence, appeals, and the strength of her academic credentials. She ultimately forced Harvard to reconsider. The institution had no legitimate academic reason to exclude her. Her qualifications were impeccable. In 1936, Fe del Mundo became the first woman admitted to Harvard Medical School's graduate program, breaking a barrier that had stood for decades. Her admission was a victory not just for herself, but for women physicians worldwide. Life in Boston presented new challenges. The 1930s were not a welcoming era for Asian students in America. Racism was casual and pervasive. Fe encountered discrimination in housing, restaurants, and social settings. As a Filipino woman studying medicine, she represented multiple minorities in a society that viewed difference with suspicion or hostility. She navigated this environment with the same determination that had gotten her to Harvard in the first place. Her medical training at Harvard and affiliated institutions, including Boston Children's Hospital, was rigorous and comprehensive. She studied infectious diseases, learning about the bacterial and viral pathogens that killed children worldwide. She trained in pediatric surgery, nutrition, and public health. She worked with leading physicians who were advancing the field of child medicine, absorbing techniques and knowledge that were cutting edge for the era. Fe also studied conditions that were particularly relevant to tropical medicine and developing nations. While her American training was world-class, she never forgot that she would return to the Philippines, where medical challenges differed substantially from those in Boston. She paid particular attention to tropical diseases, nutritional deficiencies common in poverty, and medical approaches that could work in resource-limited settings. Her years in America were professionally transformative. She earned multiple certifications, published research, and established relationships with leading pediatricians. But throughout her training, Fe remained focused on her ultimate goal: returning to the Philippines to improve child healthcare in her homeland. The knowledge she accumulated in American hospitals would be deployed in Manila's very different medical landscape. Fe del Mundo returned to the Philippines in the late 1930s, bringing Harvard training to a nation desperate for medical expertise. What she found shocked her despite her awareness of the country's challenges. Infant and child mortality rates were staggering. Preventable diseases killed thousands of children annually. Medical facilities were inadequate, concentrated in Manila and other cities, while rural areas had virtually no healthcare infrastructure. Poverty compounded medical problems. Most Filipino families could not afford medical treatment. Hospitals charged fees that were modest by American standards, but insurmountable for families earning subsistence wages. Children died not because medicine couldn't help them, but because their families couldn't pay for treatment. The injustice of preventable death determined by economics rather than medical necessity violated everything Fe believed about medicine's purpose. She established a medical practice treating children, quickly building a reputation for competence and compassion. Unlike many physicians, Fe didn't turn away patients who couldn't pay. She treated poor children alongside wealthy ones, often providing care for free or at reduced rates. Her practice grew, but individual treatment couldn't address systemic problems. The Philippines needed better healthcare infrastructure, more trained pediatricians, and fundamental changes in how child medicine was practiced and funded. Then came World War II. The Japanese invasion and occupation of the Philippines devastated what little healthcare infrastructure existed. Hospitals were damaged or destroyed. Medical supplies became scarce. and the entire healthcare system operated under crisis conditions. Fe continued treating children throughout the war years, working in makeshift facilities with limited resources. She saw children suffering from malnutrition, war injuries, and diseases that flourished in the chaos of occupation. The post-war period brought new challenges. The Philippines gained independence in 1946 but faced massive reconstruction needs. The economy was shattered, infrastructure destroyed, and the population struggling with poverty and displacement. Medical needs were overwhelming, but resources remained scarce. The government prioritized basic recovery over healthcare investment. Fe worked tirelessly throughout this period, treating patients while growing increasingly convinced that the Philippines needed dedicated pediatric facilities. General hospitals treated children as small adults rather than recognizing that pediatric medicine required specialized knowledge and approaches. Nurses and staff lacked training in child-specific care. Equipment designed for adult patients was poorly suited for treating infants and children. She began advocating for a children's hospital, presenting the idea to medical colleagues, government officials, and anyone who would listen. The response was skeptical at best. Critics argued that the Philippines couldn't afford specialized facilities, that general hospitals were sufficient, and that resources should go toward basic health care rather than specialized institutions. But Fe understood what critics did not. Without specialized pediatric care, Filipino children would continue dying at rates that were unconscionable in an era when medical knowledge could prevent such deaths. By the mid-1950s, Fe del Mundo had concluded that waiting for government funding or private investment was futile. If a children's hospital was going to exist in the Philippines, she would have to build it herself. The decision was both courageous and financially reckless. She was a physician, not a wealthy heiress. Building and operating a hospital required capital she didn't possess and financing she couldn't secure. Banks rejected her loan applications. The business case for a specialized pediatric hospital seemed weak to financial institutions focused on profitability. How would a hospital that accepted patients regardless of ability to pay generate revenue? Who would staff it? Where would equipment come from? The questions were legitimate, but they missed the point. Fe wasn't building a hospital to maximize profits. She was building it because Filipino children were dying unnecessarily. She made the decision that would define the rest of her life. She mortgaged her home, putting at risk the property she had purchased with years of savings. She sold possessions, pawned jewelry, and liquidated assets. She invested everything she owned into the hospital project. Friends and family worried she was courting financial ruin. Fe understood the risk but accepted it. Some things mattered more than financial security. The search for a suitable building took months. She needed something affordable but convertible to hospital use. Located accessibly in Manila, but not so expensive that purchase would consume her entire budget. She found a 2-story house on Quezon Boulevard that met her requirements. The structure wasn't ideal. It was designed as a residence, not a medical facility, but it could be adapted. She purchased the property and began planning renovations. The transformation of a house into a hospital required extensive work. Rooms needed to be converted into patient wards, examination areas, and treatment spaces. Plumbing and electrical systems had to be upgraded to support medical equipment. Specialized ventilation was necessary for infection control. Every modification cost money Fe didn't have in abundance, forcing her to make constant compromises between ideal design and affordable reality. Equipment acquisition presented another challenge. Modern medical equipment was expensive and primarily available from foreign manufacturers. Import costs added substantially to prices. Fe purchased what she could afford and improvised the rest. She sought donations, negotiated with suppliers, and accepted second-hand equipment that wealthier hospitals were discarding. Every incubator, examination table, and surgical instrument represented a small victory in her campaign to create functional pediatric facilities. Staff recruitment was equally challenging. The Philippines had few trained pediatric nurses. Fe would need to train staff herself, teaching nurses specialized skills for treating children. She recruited young nurses willing to learn, offering training in exchange for commitment to the hospital's mission of serving all children, regardless of family wealth. The staff she assembled shared her dedication, if not her medical expertise. Throughout months of renovation and preparation, Fe continued her medical practice, treating patients while simultaneously planning the hospital. She worked exhausting hours, sleeping little. Driven by vision and determination, colleagues watched with a mixture of admiration and concern, wondering if her impossible dream would succeed or leave her financially destroyed. Children's Memorial Hospital opened its doors in 1957, the Philippines' first hospital dedicated exclusively to pediatric care. The facility was modest by international standards, a converted house with limited beds and basic equipment, but it represented a revolution in Philippine healthcare. For the first time, seriously ill children could receive treatment from doctors and nurses trained specifically in pediatric medicine. The hospital's founding principle was radical and potentially unsustainable. No child would be turned away for inability to pay. Fe implemented a sliding fee scale where wealthy families paid standard rates, while poor families paid what they could afford, which was often nothing. This cross-subsidy model meant that the hospital operated on perpetually thin margins, constantly balancing between financial sustainability and its mission to serve all children. Word spread quickly through Manila's communities. Parents who had previously avoided hospitals because of cost brought their sick children to Fe del Mundo's facility. Patients arrived with conditions ranging from routine infections to life-threatening diseases. The hospital treated infants with respiratory problems, children with malnutrition, cases of tropical diseases, and accident victims. The demand immediately exceeded capacity. Fe and her staff worked grueling hours. The hospital had limited beds, meaning difficult decisions about which patients to admit. Fe often treated children in hallways and waiting areas when beds weren't available. She personally examined every patient, refusing to delegate initial assessments to junior staff. Her hands-on approach created bottlenecks but ensured quality care. Equipment limitations forced innovation. When the hospital couldn't afford modern incubators for premature infants, Fe designed alternatives using bamboo and other local materials. These improvised incubators worked on the same principles as expensive imported models, but cost a fraction of the price. The bamboo incubators became symbolic of Fe's approach, using ingenuity and local resources to solve problems that wealth solved elsewhere through technology. Infection control presented constant challenges. The converted house lacked the specialized air handling and sanitization systems that purpose-built hospitals possessed. Fe compensated through rigorous protocols about sterilization, hand washing, and patient isolation. She trained staff obsessively about preventing cross-contamination between patients. The hospital couldn't match the physical infrastructure of modern facilities, but it could exceed their standards for medical practice. The nursing staff learned pediatric care through immersion. Fe taught them how to handle infants, how to recognize signs of deterioration in sick children, how to communicate with frightened parents. She emphasized gentleness and patience, understanding that treating children required different skills than treating adults. The nurses she trained became the foundation for expanding pediatric care throughout the Philippines, as they eventually moved to other hospitals and clinics. Patient outcomes exceeded expectations. Children who might have died at home or been turned away from other hospitals survived because of treatment at Children's Memorial. Fe personally delivered news of recoveries to families, experiencing satisfaction that no award or recognition could match. Each child who walked out of the hospital healthy was validation of her impossible dream. Fe del Mundo's greatest contributions to medicine emerged from the constraints she faced. Working in a resource-limited environment, forced innovation that would influence pediatric care far beyond the Philippines. Her approaches to treating children with minimal equipment and limited budgets provided models for developing nations worldwide facing similar challenges. The bamboo incubators were her most famous innovation. Premature infants require carefully controlled temperature and humidity to survive, typically provided by expensive mechanical incubators. Fe couldn't afford sufficient numbers of these devices, so she designed alternatives using bamboo frames, hot water bottles, and careful monitoring. The bamboo incubators maintained appropriate conditions for premature babies at a fraction of the cost of imported equipment. Her design spread to other resource-limited hospitals, saving lives throughout Southeast Asia. Her research on infectious diseases affecting Filipino children advanced medical understanding of tropical pediatric conditions. She studied dengue fever's effects on children, documenting symptoms and treatment approaches specific to pediatric patients. Her work on measles, still a major killer of Filipino children in the 1960s and 1970s, contributed to public health campaigns and vaccination programs. She published findings in medical journals, sharing knowledge with the international medical community. Nutrition research became another focus. Fe recognized that malnutrition contributed to many childhood deaths, weakening children's ability to fight infection and recover from illness. She studied the specific nutritional needs of Filipino children, considering both the nutritional content of local foods and the economic realities of poor families. Her recommendations influenced government nutrition programs and provided practical guidance to families struggling to feed their children adequately. Fe established training programs for pediatric nurses, recognizing that expanding child health care required creating a workforce of specialists. She developed curriculum covering child development, pediatric diseases, and specialized care techniques. Nurses who completed her training program spread throughout the Philippines, bringing improved pediatric care to hospitals and clinics across the country. Her educational efforts multiplied her personal impact, creating systemic improvements in child health care. Her medical publications numbered in the dozens, covering topics from infectious disease management to innovative medical equipment design. She presented at international conferences when finances permitted travel, sharing her experiences treating children in resource-limited settings. Western physicians learned from her approaches, recognizing that innovation often emerged from necessity rather than abundance. Fe mentored younger physicians, particularly women entering medicine. She understood the barriers women faced and worked actively to help female doctors succeed in a male-dominated profession. Her example inspired a generation of Filipino women to pursue medical careers, knowing that gender need not limit their professional aspirations. The mentoring relationships she developed created networks of physicians committed to serving underserved populations. Her workday typically began before dawn and extended well into evening. She saw patients, supervised hospital operations, conducted research, taught nursing students, and handled administrative duties. Colleagues marveled at her stamina and dedication. Fe seemed tireless, driven by commitment to child welfare that never wavered despite exhaustion and frustration. Fe del Mundo recognized that hospital-based care, however excellent, couldn't reach the majority of Filipino children. Most families lived in rural provinces, far from Manila's medical facilities. Transportation was difficult, costs prohibitive, and medical infrastructure non-existent in many areas. If child health care was to improve nationally, the approach had to extend beyond hospital walls. She became an advocate for maternal and child health programs, pushing the Philippine government to invest in preventive care and rural health initiatives. Fe argued that preventing childhood diseases was more cost-effective than treating them, that vaccination programs could save thousands of lives, and that basic health education for mothers could reduce infant mortality dramatically. Her advocacy influenced government policy, contributing to the establishment of national programs addressing child nutrition, immunization, and maternal health education. Fe established a medical education foundation to train pediatricians and provide scholarships for medical students from poor families. She understood that expanding pediatric care required creating more specialists, particularly doctors willing to work in underserved communities. Her foundation supported students who committed to practicing in rural areas after completing their training, helping to address the massive disparity in healthcare access between Manila and the provinces. Her rural health initiatives included mobile medical missions that brought pediatric care to remote communities. Fe organized teams of doctors and nurses who traveled to provinces, providing free examinations, treatments, and health education. These missions reached children who would never access hospital care, identifying serious conditions early enough for intervention and teaching families basic health practices that could prevent many common childhood illnesses. Fe influenced medical education curriculum at Philippine universities, advocating for training that prepared doctors to work in resource-limited settings. She pushed for increased emphasis on tropical diseases, practical improvisation, and public health approaches. Medical schools began incorporating her recommendations, producing graduates better prepared for the realities of Philippine medical practice, rather than idealized conditions found only in wealthy hospitals. Her influence extended to international organizations working on global health issues. The World Health Organization and UNICEF consulted with Fe about pediatric care in developing nations. She provided practical insights about what worked and what didn't in resource-limited environments, helping these organizations design programs that could actually be implemented, rather than requiring infrastructure that didn't exist. Government officials sought her advice on health policy, recognizing her unique combination of medical expertise and practical experience serving poor populations. Fe wasn't shy about criticizing inadequate policies or pushing for greater investment in child health care. Her reputation protected her from political retaliation that might have affected less prominent advocates. She remained involved with Children's Memorial Hospital throughout her life while simultaneously pursuing these broader initiatives. The hospital remained her foundation, the place where theory became practice, and where she could directly impact children's lives. But her vision extended far beyond one institution to systemic changes that could improve child welfare throughout the Philippines. International recognition arrived in 1977 when Fe del Mundo received the Ramon Magsaysay Award for public service, often described as Asia's equivalent of the Nobel Prize. The award citation praised her pioneering work in pediatric medicine, her innovations in child health care, and her lifelong commitment to serving the poor. Fe attended the ceremony in Manila, accepting the award with characteristic humility, emphasizing that the recognition belonged to all who worked to improve child welfare. Additional honors accumulated over subsequent decades. The Philippine government designated her a national scientist, the country's highest recognition for scientific achievement. International medical organizations awarded her memberships and citations. Universities granted her honorary degrees. Awards lined her office walls, tangible recognition of extraordinary contributions to medicine and public health. But Fe valued different measures of success more than awards. The thousands of children she treated personally, examining each patient carefully regardless of family wealth, represented her true legacy. Former patients, now adults, brought their own children to her for treatment, creating multi-generational relationships with families she had served. The continuity demonstrated trust that no prize could equal. The hundreds of doctors she trained and mentored carried her influence throughout Philippine medicine. Her former students led pediatric departments at hospitals nationwide, taught at medical schools, and operated clinics in underserved communities. They spread her philosophy that medical expertise created responsibility to serve those most in need. Her intellectual descendants numbered in the thousands, each one extending her impact. The systemic changes in pediatric care she inspired transformed child health care in the Philippines. Infant mortality rates declined dramatically during her career, from devastating levels in the 1940s to rates approaching those of developed nations by the 2000s. While many factors contributed to this improvement, Fe's advocacy, research, and training programs played significant roles in the transformation. Children's Memorial Hospital, the converted house she had risked everything to create, evolved into a modern medical institution. The original facility expanded multiple times, adding new wings and specialized departments. The hospital Fe founded continued operating according to her principles, never turning away children for inability to pay while maintaining standards of care that rivaled any pediatric facility in Southeast Asia. She continued working well into her 90s, maintaining her medical practice and staying involved with the hospital she had built. Colleagues marveled at her stamina and continued dedication. Fe seemed incapable of retiring, driven by the same commitment that had motivated her throughout her career. Children needed medical care, and she remained capable of providing it. The calculation was simple. Her 90th birthday in 2001 was celebrated nationally, with tributes from government officials, medical organizations, and grateful patients. Fe attended the celebrations reluctantly, uncomfortable with attention that she felt should focus on child welfare, rather than her personal achievements. She gave a brief speech emphasizing that much work remained, that too many Filipino children still lacked adequate health care, and that her birthday should motivate renewed commitment to serving the underserved. Fe del Mundo died on the 6th of August 2011 at age 99. Having dedicated 8 decades to pediatric medicine, her death was mourned nationally, but the truest measure of her legacy lived in the millions of Filipino children who received better health care because of systems she helped create. The hospital that began in a converted house continued operating as a modern medical institution, treating thousands of children annually according to principles Fe established decades earlier. Child mortality rates in the Philippines had declined dramatically during her lifetime. Transformation she contributed to through direct care, research, advocacy, and training. Her innovations influenced pediatric care throughout developing nations. The bamboo incubators, the improvised equipment, the training methods all became models for healthcare providers working with minimal resources. Her example proved that excellence in medicine required dedication and ingenuity, not just expensive equipment. The physicians she trained carried forward her commitment to serving the poor. Her influence extended through professional descendants who shared her conviction that medical expertise created moral obligation to help those who couldn't afford care. Fe del Mundo's life demonstrated that one person's determination could transform systems, that barriers existed to be broken, and that courage to risk everything could change countless lives. She refused to accept that Filipino children should die for lack of medical attention, and spent a century proving that dedication could overcome insurmountable obstacles. Her legacy is measured not in monuments, but in heartbeats, in children who lived because one doctor decided that no child's life should be determined by their family's wealth.